Now, back in 2008, I saw you for, you said, how many discs, you said? Three?
Three herniated discs.
Okay. And go on what you were going to tell me before I interrupted you to do this.
Yeah, I went in for the physical therapy and the treatment here,
Mm-hmm.
and it seemed to help in the pain. I was having a lot of pain. So I was able to return back to work and do my normal job for a number of years before I retired.
Mm-hmm. Now,
So,
I show that it had described a left foot numbness
yes.
on the outer end,
Yes.
the end, and you walked unweighting that left side because it was painful. The leg was painful. Now, my notes show that we took that away, and you had a full range of motion when you left, and there was no pain. So that was '08. It's 2013 now. 4 years?
Yes.
So for 4 years, you were able to continue your career, right? And you went back to work?
Well, I went back to work after my treatment here, but I retired in August of 2009. I took a voluntary retirement. I took a job transfer.
Mm-hmm.
So I didn't have to do the physical work much longer than a year after 2008.
Did you ever go to my website and look at my website? Do you remember that?
No, I don't recall because I don't have a computer.
I taught you then the bulk of what you needed to know.
Yeah, the
about
stretching exercises.
how to self-manipulate your back. Could you use those, we'll call them exercises, I call them maneuvers, but were you able to use those to get yourself out of pain when it came intermittently?
Yes, I did use those exercises to relieve my pain so that I could continue my normal activities, which was working, walking, things like that.
And I most probably taught you the mechanics of the disc and how the disc
Correct.
functioned, and you applied that understanding to prevent episodes of pain. So tell me whether that worked or not, whether it reduced the frequency of the pain over time.
It did reduce the frequency of the pain and the numbness in my left foot.
Mm-hmm.
I still suffer with sciatica numbness whenever I walk,
Mm-hmm.
but other than that, the pain is not there, and at least I can walk 4 to 5 miles a day without much pain.
The numbness then that you came to me with was permanent. I mean, you
It's
apparently
permanent.
damaged the nerve.
Yes,
but you didn't have to go and get an operation.
No surgery,
Yeah.
no. I didn't
And
have to.
at least we put the disc back in, and you didn't have that stabbing pain that was immobilizing at the time.
Right. I didn't have the pain in my back like a knife. Every
Right.
time I moved a certain way, a knife was in my back and just twisting
Mm-hmm.
and caused a lot of pain, which went all the way down the back of my leg into my left foot area,
Mm-hmm.
which caused the numbness.
Yeah. Well, that was the nerve damage.
That was the nerve
But
damage.
I can't make nerves better, but
Yeah.
I stopped the damage from going so far as to make you have muscle loss and atrophy of the muscles and weakness and paralysis of your leg, at least.
Yeah.
So I guess that's
I feel as though I'm physically better because of some of the treatment that I've received, and took it upon myself to let my body heal itself through natural means without surgery and a lot of scar tissue that causes when you have surgery. So,
yeah. So you were able to avoid surgery.
Exactly.
Oh, great.
Yeah.
You wouldn't mind if I put this on my website as a testimonial to tell other people, would you?
I'd be happy to.
Great. Excellent. Thank you very much.